in the first round, I would like each of you to say, what is the issue you are focused on? What is the problem that you are writing about, speaking about? What is it that you are trying to solve? You're writing books, you're giving lectures, you're writing articles, you're doing videos, you're in documentaries. What is the actual issue? Let's name it as clearly as we can. What it is, what problem is it that you are trying to solve that we want our audience to know about? In the same first part, I would like you also to address what happens if nothing changes. In other words, if we don't make any positive changes, where is this trend going in 10 to 15 years? So we're naming what the problem is that you write and speak about, and where, if we do not address this and change the trajectory, where will this be in 10 or 15 years? That's the first round. That should, each of you should speak for 2 or 3 minutes answering that. That's round one. Round two, I would then like you to ask, what is the solution to the problem that you gave in the first round? What is the solution, and why doesn't the public know this? So in the second round, we want to say, what is the solution, and why doesn't the public know this? In the third round, I'll repeat this also, so you don't have to. In the third round, I want to ask, what has happened when you have told the media, the politicians, the government agencies, the scientific community, the university and educational community, the medical, scientific, and nutritional journals? In other words, this isn't the first time you're announcing this. What happened when you told all these people? Did they stop everything and make a giant public announcement? Did they change policy? What did they do? Why is society, all these people that we trust and respect and count on, not responding appropriately? And then number four, the punchline, the reason for this entire panel. The number one thing we're trying to discuss is, are there any common causes or reasons for all of these issues? Because although I'd like to figure out what to do about the coral reefs, is that one of 100 issues? Is there an overarching theme that is behind all of these different issues? Because if we could solve what's causing all of these problems and go to the core issue, that's even more powerful than just figuring out how do we stop the coral reefs from bleaching. And then finally, in the fifth round, the question is, what can individuals do? What would be the most effective thing that everyone on this call could do? Okay, so I'm going to quickly review that. The first round, what are the issues that you're focused on? What is the problem or challenge that you are spending the last 10 years speaking and writing about? And what's going to happen if this is not addressed or changed? Where are we going in the next 10 or 15 years? In the second round, what is the solution to your problem, the problem that would work? And why doesn't the public know this? In the third round, what has happened when you've told the influential people in society, the media, the politicians, the government agencies, the scientific community, the university and educational community, the medical, scientific, and nutritional journals? And then in the fourth round, what are the common things that all of you have in common that's causing this? Where is the public and the government failing? What are we doing that's allowing so many different issues to fester and get under and not be resolved? And then finally, in the fifth round, what can individuals do? What would be the most effective thing we can do to resolve these issues? And I hope by this point, the audience knows that these speakers are doing everything they can. But if anyone is thinking that they've got this covered and this is just for entertainment, you have a misunderstanding. They're transferring this to us, and then it is up to us to find a way to take action, either physically or to financially support people that are taking action. So that's what we're trying to do in each of the 5 rounds. Each of you take 2 or 3 minutes in each round, and each of you should speak in each round. So why don't we get started? I will let whoever is moved to speak first speak, and you can find your way with whatever order you think is best. But each of you should speak in each round. That's so we can get started.
What's the first question?
What is the issue that we're all focused? What is the issue that you've been focused on? What is the problem? What's the challenge we're trying to solve? What are you doing for the last 10 years that is the issue? And what's going to happen if there's no change in behavior to this issue over the next 10 to 15 years?
I can start from my experience. Of course, I really always wanted to know why people are getting sicker and why the earth is getting sicker at the same time. It's kind of coincidence. So in our work here at Hippocrates, of course, every guest that comes and goes through our program is another kind of research and showing that humanity can heal. They can actually have an amazing life if they choose so. So, the last, I would say, for me, more than 45 years, I've been working with this. And people definitely, I would say the last 15 years, people are sicker than ever I can remember. They have gone down in the ages. And this is really, this is heartbreaking because now the people that come here are much younger with the same problem that people had when they were 70, 80 years old. So we are destroying, I did lecture today about the microbiome and how kids today actually don't have as good microbiome as my generation had. And where is that heading? Where is everything heading? Where is the quality of our food from the soil? And where are we heading? So that has definitely been my interest. And if we don't change, like the group I talked with today, they're stuck in a lot of traditions, and they think they're going to lose something if they go plant-based. And instead of, I try to show them the whole big picture. We are in this together, and we need to support each other. And we can do it with our wallet. For sure, we can do it with our wallet by not shopping the stuff that's junk and keep that part of food in our stores. We don't need it. We can get rid of it if we don't buy it. So I think we make choices in how we eat and choices how we live, how choices about our environment too, the house that we make. If we build a house, that we make it green. We don't use products that is going to hurt nature in any way. So that's been our thing and my thing to find out, why are people so sick and why is the nature going downhill?
Okay, I guess no one's speaking, so I'll jump in. We're all very shy at this hour. So I would like to, jump off and kind of also iterate what Anna was saying. So I've been a practicing internist, rheumatologist, and now an environmental health specialist, as well as integrative medicine doctor for almost 20 years now. And I've had the opportunity to watch people over time and manage autoimmune disease, manage chronic illness over a 20-year period. And then following the epidemiology and the science, I've seen much of what you're describing, Anna, in terms of increase in autoimmune disease. We now have 10% of the US population has one type of autoimmune disease, be it, gastrointestinal, rheumatologic, neurologic. 6 out of 10 Americans have at least one chronic illness, often predisposing them to higher rates of inflammation and inflammatory disease, and obviously leading to a worsened response to an infection such as COVID, which we will likely have more of these events in the future, bringing it back to climate change. So my concern and my frustration has really come from managing more and more sick patients at younger ages with illnesses that were typically reserved for older generations, such as thyroid conditions, autoimmune thyroid disease, and really trying to figure out how environment and how our, specifically chemicals, is what I do a lot of, but also radiation, as Theodora does, how all of these environmental factors, including stress and poor sleep and too much lack of exercise, and unprocessed or ultra processed foods, I should say, and particularly drinking water, and how all of these together really are shaping the future of human health. And it's not in a trajectory that's positive. It's really in a trajectory that's looking more negative, unless people really start to understand the very basics of human health and anthropology. So my goal really is to get environmental health information into the public through the Smart Human, which is my educational platform. I sell nothing, I endorse nothing. So the Smart Human, but I'm working to get this into high schools nationally. I believe that the younger we get health and prevention information into high schools, where they have the opportunity to proactively manage what they put in, on and around their bodies, potentially for future generations as well. I think that's really where I have found the most interest from my work, and the most ability to embrace this type of information. So, as much as I teach everyone and anyone, college and patients and the community on my platform, my real love is to teach younger people to really embrace this, and it's been quite positive. So I just want to leave it on that note, that I'm hopeful that this kind of work will translate into less disease, both chronic and acute illness, as we move forward.
I'll go next. I'm Stephanie Seneff. I'm at MIT, and I basically got interested in autism back in 2008, wanted to understand what was causing the alarming rise in autism over time. And I thought I could just systematically look for toxic chemicals in the environment whose exposure was going up for the autistic kids over time, to try to find which chemicals might be in combination causing the autism epidemic. I searched for 5 years and I was very frustrated. I understood a lot about autism, about all the comorbidities, but I understood that I hadn't found the answer. And I just happened to hear a lecture by Professor Don Huber, 2-hour presentation on glyphosate. At the time, I didn't know what that chemical was. I'm embarrassed to admit. I learned that it was Roundup, and I knew what Roundup was, but Roundup is a huge factor, I think, in the chronic, not just autism. I've later found out that all these other diseases are going up dramatically in our population, exactly in step with the rise in glyphosate usage on core crops. And I think it's a hidden toxin because we think it's safe. And so people use it on their yards with their kids playing around. They'll be spraying the dandelions. They don't realize that this chemical is very toxic. We've been deceived by the company that manufactured it. We've been deceived by the government. The government says that it's safe. They don't even have to test to see how much is in the food, but it's all over the food supply. And so this is a very, very dangerous chemical, because it turns out that it's insidiously, cumulatively toxic in an extremely unusual way, a unique mechanism of toxicity that no other chemical possesses. And this is the topic of my new book, Toxic Legacy. I believe that we can explain. People say correlation doesn't necessarily mean causation. We have stunning correlations between the rise in autoimmune disease and neurological diseases, various cancers, and of course, all kinds of gut problems, liver disease, kidney disease. All these things are going up dramatically, exactly in step with the rise in glyphosate usage on core crops. So I've become obsessed with this chemical, and it's been my life for the past 10 years, I guess. And I believe it's the answer. I mean, it's not the whole story, of course, because we have so many other chemicals that we are exposed to, but this one stands out because it's by far the most used herbicide on the planet. And it's considered to be very, very safe. And that's a very, very dangerous combination. So that will be my topic tonight. And I think when you look at food and you say this food is not healthy, that food is healthy, you need to look at the level of glyphosate in the food to decide whether it's healthy or not. That needs to be a factor, and people are ignoring that factor. So, I mean, the solution is easy. Go back, I mean, in theory, get rid of the toxic chemicals, go back to organic agriculture. And I'm really, really happy that we have the certified organic label, because that's what saved me. I'm able to just purchase certified organic food, and I encourage everybody to do that. Very simple step you can take personally to help keep your personal health and your family's health in check, to keep your family healthy. And of course, we need to put pressure on the farmers. We need to put pressure on the government to stop funding the toxic chemical-based agriculture with the large, huge farms. We need to go back to small family farms, and we need to go back to certified organic. So that's my top level message.
Well, my name is Theodora Scarato, and I'm Executive Director of Environmental Health Trust. And I got involved in this about a decade ago as a social worker. And we were using cell phones for, you know, it was free long distance. That's how I talked to my grandparents. And I had absolutely no idea that it hadn't been pre-market tested. And that sort of set me on to the trajectory of working on the issue of technology. What is healthy technology? How can we be more responsible with our technology? Because what I found out was that, you know, our cell phones, wireless, emit a type of radiation which has thousands of studies showing harm. In terms of climate, however, let me add this: at any point in the life cycle of that device, there are human rights abuses, impacts physically to people who interact with it from the manufacturer, and climate impacts from the resources that are spent on the material that make up the phone or the device, and then all the way to the end user, to our children who are addicted, our adults who are addicted to this technology, and we're running in hard with it with 5G. So then the e-waste at every point of the life cycle of a device, the recycling that's happening in communities or families who are taking apart our phones and our laptops and being poisoned by the environmental and the heavy metals that are involved, or maybe they're burning charging wires. There are communities, they get all the wires and they burn them to get the copper and to get the metal, and they're inhaling those fumes. And yet we are insatiable as a society for technology. We're using technology right now in a very productive way in learning, but between the wireless diapers and 5G, which will bring over 500 billion new wireless devices and over 70 million new cell towers for 5G, I think we're looking at disaster, an environmental nightmare if we don't take action on making our technology healthy. So that's what I'm working on, is raising awareness on this issue and putting forward solutions, because there are solutions so that we can move forward in a more responsible manner.
Well, I'll go next. My name is Bohanec, and I just want to start by saying I'm just honored to be on a panel with such amazing women that have done so much research and so much good for all of us. So I'm honored to be here. And I also want to thank Stephen for having me. And that's because I come from a very different angle. I am actually not a health expert. I am not focused on human health. My focus is the animals and the environment, particularly farmed animals, and the environmental impact of animal agriculture. And those are my specialties. That's what I've been working on and researching for 30 years. I've been vegan for 30 years. And there's so much that has changed over those 30 years, and some things are very exciting. We've had a lot of wonderful advancements, but one thing that has happened that is something that I focus my research on is this shift in the market as a response to the good work that animal advocates have done of exposing just the horrors and the suffering that the animals endure in animal agriculture, all that they suffer. The market is now responding to try to make people feel more comfortable with these products, with humane labeling and sustainable labeling as far as the environment goes as well. So we're seeing all kinds of labels like cage-free and free-range and organic to make us feel better about what's happening. But what's happening is we're having undercover investigators going into these farms, into these slaughterhouses, and finding again and again and again so much suffering, body mutilations to these animals, separation of families, slaughter at such a young age, psychological distress, just so much suffering. And so I'm here today really to be a voice for those animals. They have their own voices. They're crying out in pain and distress every day. So they do have their own voices, but we don't listen and we don't speak their language. So I'm here to speak for them, and as well to really speak for the planet, because, and this is one of the other hopeful parts, is that now the environmental impact of animal agriculture is finally starting to come into the mainstream, into journalism and environmentalism. We are talking more about it, which is great. And I am grateful for that. And I'll see something in Time Magazine or National Geographic that we're talking about the impact of animal agriculture. And, I'm just so grateful. However, the industry once again is responding, and we're seeing labels like free range and sustainable and grass-fed and all these labels that are just unfortunately not holding water scientifically. It is animal agriculture inherently that is so impactful, no matter how it's done, very impactful on the planet. So I'm here today to speak for the animals, for the planet, and I'm just grateful to be on this panel. And I think the second part of the question is, what would happen if we don't make changes? And I'll just say quickly that what is the trajectory that we're on is that billions of animals are suffering horribly, and that will continue. And climate change, climate disruption, a myriad of environmental impacts are spiraling out of control. And a lot of it is due, so much of it is due to animal agriculture that could so easily be changed. A global shift to a plant-based diet, we wouldn't need, government involvement and lots of money and infrastructure change. It just takes making different choices at the grocery store. So yeah. So I'm grateful to be here, and thank you.
I can go next. I'm really honored to be part of this panel, and I know that we all have differences of opinions, but I think there are many things that we all share very much in common, like what you were just talking about, Hope. I have been a vegan for about 32 years, and when I started on this journey, I can tell you that it was not cool to be a vegan dietitian, and the reason that I do what I do is I'm so determined to help people understand the consequences of their food choices for themselves, but mainly beyond themselves. That I want people to be able to see the big picture. I want them to understand what it is to be as ethical a person as you can be. I want them to understand that when they purchase food, they are impacting billions of animals, and they are impacting billions of people, and they are setting in stone what's going to happen to this planet in fairly short order. I just, with everything I have, want people to recognize that we have to be more conscious in our choices. We have to recognize that we are responsible for so much pain, suffering, and death that is not only unnecessary, it's unjustifiable. And I do what I do largely because I care about animals, and I care about this planet. I care about my grandchildren. And, we are destroying the very fragile life support systems of this planet. And it's got to stop. I mean, I remember, Albert Schweitzer saying, and, the Nobel Prize winner from, I think it was 1952 or something like that, that the time will come when people recognize that, what true ethics really is, and that we can't
we can't be doing what we're doing. And I think he would be absolutely shocked that in 2021, we're still where we are. But the one thing that I think makes me feel hopeful is that this message is getting out. I can tell you, it is not the same to be a plant-based dietitian in 2021 as it was in the 1980s. And that makes me hopeful. And to see the number of physicians who are on board, who are really wanting to help their patients get well. And I mean, I do a lot in terms of lifestyle medicine and, you know, doing research with diabetes and helping people to transform their lives. And for me, that's a really important part of what I do. But my ulterior motive is the animals and the planet. And I think human health is a wonderful byproduct of that. We will improve it tremendously. So that's my story.
I wouldn't mind following. I wanted to say that I'm so grateful to be here and honored to be all of you women here, and thank you for all of your work. Brenda, you've made vegan dietitians a cool thing. It definitely is now. And I spent the beginning of my career trying to make nutrition simple and make it so people were not afraid, like talking about, you know, like what we're all taught is this deficiency paradigm, and people are so concerned about getting enough and more and more and enough, and more protein, more this, more that, more this, enough, this vitamin, that vitamin. And I spent my first 10 years or so trying to make sure everyone knew, yes, you can get this from plants. Yes, you can get it on the plant-based diet. And I went around the world and wrote books and did TV. It was all about where you get your fill in the blank nutrient. But I've since kind of changed, well, not changed my tune, but I've kind of gotten to the place where, you know what? I think one of the reasons, it looks like one of the reasons a whole food plant-based diet is so efficacious at reducing risk of chronic disease, at reversing certain diseases, at so many wonderful, extraordinary things, is because of what it's naturally limited in. So now I'm kind of touting the actual benefits of it not being, you know, high in protein, all that stuff, whatever it is. Like, I'm trying to get rid of the language of macro confusion and trying to get rid of talking about nutrients in these ways that are so confusing, because everyone is so confused. And the long-term problem about everyone being confused is that people end up being hopeless, apathetic, and feeling disempowered. And so what I'm focusing on now in my career and my work and my messaging to everyone is to give people back their voice, that they get to choose what's on their fork. No one gets to tell them what to eat. No one gets to tell them, oh, you're on a plant-based diet, that's weird. Like, I want people to feel like this is their body, their choice, and everyone can do, you know, better, and they could all have control over what they do with their health. There's a lot of control. We have a lot more control than we think we do. And I try to empower people to know that they're not broken, that they really do have a lot of power with what they put on their fork.
I think by default, I might be next. And likewise, as everybody has said, I'm happy to be here. And I think Steve has done an extraordinary thing to actually bring people together who might have some differences of opinion, and everybody to get together knowing we might have some differences and playing nice in the sandbox, because there's not enough of that going on right now. We need more scientific discourse. And it's come out in the last couple of weeks. I don't know if you're aware. I'll just start with why people don't know about this. One of the problems we have. 2 court cases. There's actual testimony that the government has a direct line to social media to censor people. I don't know if you guys knew that. Any message that the government doesn't like, including messages about health, they just call Twitter or Facebook and say, take that post down or deplatform that person. And I think that's a really frightening thing today. And it's indicative of the lack of communication we're allowed to have, because it's only in fussing and arguing with each other that we're going to get better, you know? So I've spent the last 26 years of my life helping people to understand what real informed decision-making is all about. And it's not finding somebody else to listen to, and it's not joining a particular tribe, it's learning enough about this to make decisions. In other words, if people bought health and diet and supplements and drugs and tests and procedures the way that they bought blenders and washing machines and retirement accounts and houses and cars, my gosh, it would be amazing the better decisions they'd make. They would do research, they would check things out. And that's what we've been teaching people to do. And many times our clients know a lot more about relative versus absolute reporting and cause and effect relationships and mechanisms of action than some of their health professionals, and they're able to make much better decisions. So the importance of informed decision making as a practice specialty, which is what we do, is only necessary because people are not required to give risks and benefits in medical settings. In other words, one of my employees just bought a house and spent 2 hours with full disclosure. Have you ever been through this process? Document after document after document, you have to read it, you have to sign it. This is so you know what you're getting into when you sign a mortgage. But you know something, people sign up for $300,000 worth of treatment, and here's the way it goes. The doctor says, you need this, and the patient says, okay, next Thursday is good. And then we just proceed. And I think there's something wrong with that. So that's what I've been spending my life on. I've written a couple of books about it. And what I'm working on today is, I think, the biggest episode of not disclosing truth about things we're living through right now. And we're the people who are suing everybody. I'll just put it out there. We can talk about it or not talk about it, but we just filed another lawsuit today, and we're filing 4 more by Monday, challenging all this that's going on, because we're not being told the truth about it. And it's appalling. You know, whatever's going on, we deserve to know the truth about it. And we have some very incredible documents that are pretty frightening. So I guess what's happened is, for 26 years, I've been training for the Grand Prix of Informed Medical Decision Making, which is a worldwide event in which I think a lot of misrepresentations are being made, and in which is affecting everybody, so 7 billion people. And I think we need to get to the bottom of it. And so we can have some differences of opinion about what's going on, but what I think is not acceptable is the government calling Twitter or Facebook or whatever and saying, we're not even going to have any discussion. And if a person brings up an alternative point of view, we're shutting it off. So some people in this group might have a point of view that the government likes. And I don't think that that should be the litmus test for who speaks, who doesn't speak, whose platform, not do platform, whatever. So anyway, what happens if nothing changes is we're going to be lied to. We're going to be lied to for the rest of our lives, and that's unacceptable to me. And I think that if you can go to jail for misrepresenting a mortgage document, if you do it enough times, you should go to jail for not giving full disclosure about each and every medical treatment that a person is subjected to. That's not that is not a wild idea in my mind. It's not a wild idea at all. And for 26 years, what I've heard in my office is this line: if I knew then what I know now, I never would have, and then you can fill in the blank. Okay, I never would have taken that drug. I never would have had that procedure. Nobody told me that a side effect of this, you guys have heard this from friends and right? Okay. Well, I think people should know now, before. I think people should know before what they're getting into. And before I leave this planet, if it's the last thing I do, I'm going to do everything I can to make that happen. So that's what I'm working on now. And I just have a bigger platform to do it today because of the crisis that we're in.
Okay, thank everyone for the first round of answers. The next round, if you would each give a 2 or 3 minute answer, and again, in just a few words, restate what the main problem is that you see, and then as specifically as possible, what is the solution or the specific action steps that you are advocating to solve this problem? And then also, why doesn't the public know this? So again, restate again what the main problem is that we're dealing with, that, you know, in a few words, try to restate name the problem that you're dealing with, or that the issue that you believe has to be addressed. And then as specifically as possible, what is the solution that we need individually and as a government to take to solve it? And then why doesn't the public already know this? So if you each would give a 2 or 3 minute answer on that.
Can I
Should we go
start
in the same
again?
order? Yeah.
You want to start? Dr. Seneff, you start.
Oh, I didn't want to start. You can start.
Well, I think the main problem is we got comfortable in living this way. we got lazy, and we, of course, like Pam said, we're not getting the information we should be getting. So of course we don't know, and we got comfortable not knowing. That's the biggest problem. And once we want to start to know things, then we are troublemakers, right? And that we have been blocked from Facebook. A lot of you have been blocked, and I know that's what's happening for a lot of people in this field, because we're here to wake people up. Of course, we want them to see what really is going on and the danger that we all are in, and environmentally, autism. I mean, we also work with kids here that have autism, and hearing the stories from parents, what they've had to do to get them even to this place, it's heartbreaking. And this is an epidemic, and it's not going away, and we're just got comfortable. This is the problem. So probably really don't know, because we didn't get to know. And any scientist that's trying to tell us, that's screaming about it, will not be heard. So this is amazing, because I mean, this panel is fantastic. I just love it. I love to hear that everybody is really on the bandwagon to tell people and to raise our life standard, our livelihood, and our life standard needs to really be uplifted, and we can't be comfortable anymore. That doesn't exist anymore. So I think people need to realize that we're sitting on a sinking ship. But there's tons to do.
Okay, I guess shy again. I'll jump in. In the interest of time, I'm trying to get in as many rounds as possible, but I have to go soon. But I'll just reiterate, essentially my work is really understanding how all aspects of environment, not just chemicals, not just radiation, but a variety of human insults to the human body have occurred over time through, and based on anthropology, how mixed we are in terms of our exposures now than we have been for millions of years. And so, we're really living in this mismatch, and it's causing a whole host of health issues, as we're all pretty much aware. Here's the solution, in my opinion, having realized that medical schools don't teach anything about nutrition, 5 hours of nutrition over the course of 4 years of medical school, as just, nutrition. And that's currently happening. There is absolutely no discussion really of environmental health, which includes many chemicals like BPA and phthalates and plasticizers and flame retardant chemicals. No discussion of radiation, how it works, what it's about, where there may be risk to human health. How we handle stress and what that has been shown to show in the literature in terms of risk for developing a whole host of autoimmune disease. And we have great studies on this. So the solution to me, having not had it been exposed to any of this information where I should have truly been exposed, even in high school biology, college classes, is really to start with education. I understand where my lane is. I know the people very well who are working very hard on Capitol Hill to really make differences when it comes to chemicals in food, cellular radiation, EMF radiation risks. But I know that my lane is really to try to get this into as many young people's hands, whether it's med school, high school, colleges, and to really help empower people to make their own educated decisions in terms of what they put in, on, and around their bodies. And just understand that there is absolutely no testing for chemicals before they go into any of the products that we use, including cleaning products, including personal care products, textiles, furniture, and that the horse out of the stable, and now we're in a pickle. So it's really about education. I would love to help with, sort of the government regulation issues, which there are enormous amounts. Even my co-author, Dr. Fred Vom Saal, who's largely responsible for helping get BPA out of baby bottles, he and I really work together to bring both sides of the story of the regulatory failures, and then the human health issues. And I think when you know the whole story, making change is much more compelling. And that's my goal, is to give the full story, not just pieces of the story, and then help people make their own decisions based on that very well vetted scientific information. So I think the solution, the punchline, is education. And that's where I think if it gets into that realm, it will make exponential beneficial effects on human health, and actually for future generations, as we know how this can lead to future generations of issues. So that's my answer.
Okay, I guess I'll go next. So my thing is glyphosate. It's a chemical found in Roundup and many other formulations. Used enormously on our food. U.S. consumes 20% of the world's glyphosate, with only 4% of the world's population. We have about the cheapest food, according to our income, of about any country in the world. And we have the most expensive healthcare costs by far. And I think those two are joined at the hip. And I think our food is, we have these toxic processed foods that are promoted by the industry. And then, people in food deserts where they can't even buy fresh vegetables. It's really very, very hard for people to eat a nutritious diet in this country. And I think there's really inadequate awareness of the role that toxic chemicals in the food play in the value of that food. And I can give a good example with, the plant-based diet, chickpeas, garbanzo beans, and lentils. They're probably considered very healthy foods in the plant-based diets. They have, according to the Canadian government studied over 8,000 samples of food samples from Canada, as well as imports from other countries. They found those particular products to have by far the highest levels of glyphosate of any products that they examined. In many cases, the highest levels were found in those products. They're non-GMO, so people think they're safe, but they're sprayed with glyphosate right before the harvest. And there are many foods that are sprayed right before the harvest. And of course, they're all vegetarian choices. So when you eat a vegetarian diet that's not organic, you're eating a lot of glyphosate. And I think that's a problem. So I think if you're going to eat a vegan diet, it's got to be an organic vegan diet in order to really be healthy. And the oats, wheat, which is of course bread, garbanzo beans, chickpeas, sugar cane, sunflower seeds. So many different foods are sprayed right before harvest, non-GMO foods. And that, I think, is a serious problem with the contamination that we're seeing in our food. What you can do to fix the problem, there's many things people can do personally to move in the right direction. Certainly, number one, don't use Roundup on the weeds in your yard. Find another way to do your gardening. Number two, eat certified organic, and that will also force the farmers to grow certified organic, because the more we demand it, the more they're going to need to switch. And the farmers, they're going to wake up and realize they're getting non-Hodgkin's lymphoma at a young age because they're working with glyphosate. And if they cannot use glyphosate and produce a superior product that the customer wants, they're going to switch over. One by one, the farmers are going to switch over. And we need that to happen, and we need it to happen fast. And so you can also do, of course, it's hard work to work with the government. I've tried, and I'm very frustrated with it at the state level, at the U.S. government level. It's very painful because the government has been bought so severely by the industry that they basically don't even hear you. You can barely even get them to notice you, even when you try hard. A whole group of us flew to Washington, D.C. and presented our results on glyphosate to the EPA, and it was a very disappointing experience. So it's frustrating with the government, but you shouldn't give up on that. In fact, local government is very, very, in some cases, very rewarding. I gave a talk, and they organized a little seminar at a town in Connecticut, and there were 3 of us or 4 of us who talked, and the result of that was that they banned glyphosate in that town. So that was very, very rewarding. And you can go talk to your school system, make sure they're not using glyphosate on schoolyards. You can try to get your local city government to refuse to use glyphosate in public areas. These are specific things you can do. And of course, you can join organizations like Moms Across America, Zen Honeycutt. I think she's awesome. And she's really trying to grow public awareness among parents, mothers, to make them aware of the need to eat healthy food. And healthy certainly includes no processed foods. I think soy protein bars would be bad even if they weren't loaded with glyphosate. But so eating whole foods, is really, really important. And eating a lot of fresh fruits and vegetables, if they're organic, is certainly a very healthy choice. In fact, even those amazing molecules that you can find in herbs and spices, the polyphenols and the flavonoids and terpenoids, those come out of the shikimate pathway, and the shikimate pathway is blocked by glyphosate. So when you eat those foods when they're poisoned by glyphosate, they're going to have less of the nutritious value that they offer for you as a very wholesome food.
I'll chime in. I would just have to agree that it's all about education and information, and that's where it all begins. And that's why, like you, Pam, I'm concerned about social media, because that was a wonderful way to communicate. But now we've got all of this censorship, and it's very flooded with anyone has a voice on social media. And so I think people, the problem that I'm worried about is all of this confusion, and I think that's given it legs. But I also think that events like this are extraordinary for empowering people with information and education. And I think that it's stuff like this, events like this, and all the stuff that's come out over the last few years, it's kind of like this grassroots movement. So if you can't go to the government, at least we're all, we're starting here. And then the conferences that we've spoken at, which were like a few doctors here and there, healthcare professionals here and there, are now thousands of healthcare professionals. And so because people are telling people, and healthy patients are going back to their physicians, and their physicians are saying, what did you do? And I think that it's really kind of perpetuating the spread of information. And I think that hopefully that's going to continue to grow. I've seen extraordinary expansion in the last, 15 years. It's just been extraordinary to watch. I think all we could do is just keep trying to educate and empower and speak wherever we can, and keep the information and the studies and all of that coming.
Well, when it comes to technology, and thank you, I'm honored to be here. I just, to everything everyone's saying, to add on, we need to demand safer technology from companies. So both the awareness piece is critical, as well as calling on companies to make safer technology with hardware and software changes, for example, that can reduce or eliminate sources of non-ionizing electromagnetic radiation, so that we aren't being the FBI when we go to the store and are trying to find something corded or without Bluetooth or without wireless, because we're trying to decrease the levels in our home. When it comes to the environmental impacts and the climate impacts, the solution is also corded wired technology as much as possible, because when we use wireless or 5G, which is an energy hog, there's going to be an exponential increase in energy consumption from all of these new devices and all of these new cell towers. So relying more on corded technology whenever possible is a key piece of this issue. It's also faster, safer, and more secure. And then there's the lifestyle changes. I mean, we have to use it less. We don't have to have everything be wireless. Not everything has to be wireless. And I never thought I'd be saying that, knowing that when I go to the store, it seems like everything is that's for sale at our tech stores. We also need to hold our government accountable. And I recognize I am, I've been at this for a decade now, and it is so challenging to get the attention of the government on this issue. But I think we're making headway in terms of technology. There are no limits for what is safe when it comes to trees, bees, birds, and our natural environment. And this is, I'm speechless, because we're putting in all of these cell towers, trimming trees that will be, and digging up roots, as well as increasing radiation levels to our wildlife. And and something has to be done immediately. We need to halt 5G. That's what we're asking for, but it's unacceptable. And I'm really thankful that the New Hampshire Commission on 5G and the Environment did put forward a recommendation as one of their 15 recommendations to call on the government to come up with ecologically based limits. There aren't any that exist anywhere in the world. We have limits for human exposure, which are outdated and non-productive, like chemicals and all of the other environmental issues, but there have been no limits to protect animals and our insects. So I believe that the one last thing I want to say that I think is the most challenging, that I talked about, which is using less. The Shift project out of France calls it digital sobriety, and I think we'll all be healthier when we pick up a book or take a walk or turn off the phone and have that quality time when we're looking at people's eyes and not the screen. Thank you.
I'll go next. Speaking of technology, I think I had a blip and was gone, and I'm back now. So I go quickly before I'm gone again. So the question was, what is the problem? The first question of the three-part was, what is the problem? And I think for what my angle and my my research and vision is with animal agriculture, animals, and the environment and the environmental impact, I think that the problem is speciesism. And it's not a word that we hear enough. I hope we will hear more of it. And so I'm going to introduce this word now, if you haven't heard it before. And speciesism is like other isms that we know of, racism, sexism, and homophobia, other ways of saying, basically one group feeling dominant over the other, expressing domination over the other, and falsely feeling superior to another group. And in this case, we're talking about species, other species. And of course, the dominant being humans who have taken over this planet and are in every corner oppressing and suppressing the lives of non-human animals in so many ways. And this is not, it is most prevalent in farming and animal agriculture. So there's billions of animals that are suffering at the hands of humans for food that we don't need, that is unhealthy, that is causing zoonotic disease, that has so many problems. It's unnecessary. Speciesism is so prevalent in our world, in our society, in our language, in so much that we do, and it's unconscious. We don't even see it. We don't know. So it's something to become aware of, to be aware that really this is beyond just, to me, I'll just say, beyond just a diet. Veganism, a plant-based diet, is a justice issue for non-human animals. So it's beyond our own personal health and what we can get out of it. That's important, and that's a great place to start. But extending that compassion outward and protecting our planet, protecting these animals is so critical. And so speciesism is a really good thing to look at. I do briefly want to talk about fish. I saw someone in the chat say something about, and the fish. And I love that because they are really the forgotten food animal that we just don't talk about enough. And so Seaspiracy is a fantastic movie. I highly recommend it. I know there's been controversy around the science and these studies that they presented, but even if half of what they say in that movie is true, we're in trouble, and the oceans are in trouble, and the fishes are in trouble. So I highly recommend you watch that movie. I'm going to tell a brief story about fish, and then I'll move on, go on to others. But there were 2 goldfish in a tank. I think there were more goldfish, but we'll talk about the 2 goldfish, Blackie and Big Red. Now, Blackie was a little black goldfish who was born a little wonky. He was at the bottom of the tank. He kind of just could only hop around the bottom of the tank. He couldn't swim properly. And Big Red was his buddy, his tank mate. And when it was feeding time and the food was at the top of the tank, Big Red would swim down and swim under Blackie and go up and take Blackie up and let him eat first. He would let Blackie eat his fill, and then he would put Blackie back down, and then Big Red would go and eat. What are we seeing here? Big Red is expressing caregiving, friendship, selflessness, compassion. Are these attributes you would have ever thought of for a fish? Probably not. But now you know Blackie and Big Red's story, and there are so many of those kinds of stories of these sentient beings that are the fishes in our oceans. So just wanted to talk about fish. They need their moment to be talked about, and the oceans are being decimated just for this food that is unnecessary. So what are the solutions? I'll just say really quick. The solution, go vegan, going vegan, living a vegan life, living a plant-based life. The Alliance for World Scientists, talking about the environmental angle, they had this Alliance for World Scientists is 15,000 scientists over 184 countries. They were asked, what would be the best thing to do on an individual level to reduce your impact on climate change? Their recommendation was to avoid all animal products. They didn't say buy electric cars. They didn't say buy local meat. They didn't even say reduce your animal products. They said avoid all animal products. So there are powerful changes that we could make just by changing our choices when we eat. Yeah, so I'll let someone else go. Thank you.
Well, I'm really happy to follow you, Hope. I love what you're doing and I love what you're saying. So thank you for that. So in terms of the problem that I see is I see people are eating animal products and highly processed foods. And that to me is the problem, because in the process, we're hurting animals, we're destroying the planet, and of course, we're hurting ourselves. And so that to me is the problem. And in terms of the solution, I'm really excited to see the initiatives that are happening today. I can tell you, I'm a Canadian, and in 2019, we released Health Canada released the new Canada's Food Guide, and I saw a quote from the Director General of the Health Promotion and Prevention Division, and he essentially said that in this quote that the next Canada's Food Guide, the next National Dietary Guidelines, will be free of industry influence. And that is a promise to the Canadian people. And he followed through on that promise. And our food guide has three groups. Half the plate is fruits and vegetables, a quarter of the plate is grains with a strong emphasis on whole grains, or a quarter of the plate, and a quarter of the plate is what they call protein foods. But they educated the Canadian public in this guide that plant-based foods are the first choice, and when they list all of the protein options, they do include some dairy and meat and fish and so forth. But the first things listed are beans and lentils and tofu and nuts and seeds, and then comes the animal products, and they emphasize choosing mostly plant-based foods. There is no dairy group anymore. There is no exclusive meat group. The beverage that is promoted is water. And this is a huge huge step in the right direction. And I think Health Canada has really become a global leader in developing nutrition policy that's truly evidence-based. And I'm really excited that ProVeg has started an initiative to try to encourage national governments across the globe to do the same. And so we, the solution is really educating the public, empowering the public, getting them to put pressure on their members of parliament or whatever you call it in your country, representatives, whatever, and doing everything we can to educate physicians, to educate dietitians, to educate health professionals, and empower them as well. And then we really need to, we've got a group in Canada called Nation Rising, and Nation Rising is really taking to task Health Canada to make sure that all of these wonderful things that they've said in our guide and dietary guidelines are actually implemented in schools and in hospitals and everywhere in the country. And so we've got a lot of people doing wonderful work trying to get our culture to shift. And I heard the other day Tobias Lienhart, who's one of the founders of ProVeg, saying, so many people in the world eat meat because so many people eat meat. It's just we're human beings and we want to belong to a tribe. And so I think one of the biggest challenges is to make our tribe, the tribe of conscious human beings, one that is appealing, is one that would attract others. And we want to mainstream this as much as possible. And I think we're doing that. I'm not sure I would have ever believed we would be where we are, today, 30 years ago. It would have been almost unthinkable. So this is exciting. So I think there are solutions. We're working on those solutions. And, why doesn't the public know? Well, I think one of the biggest barriers to achieving the goals that we have is the power of industries that make a lot of the rules and who are so closely aligned with the policymakers, who often are the policymakers. And so that I think consumers need to understand and really make their voices heard, that we don't want that anymore. And it's possible. It's possible. We're seeing it in Canada. It's possible everywhere. So we really need to get industry to make changes. And the good news is industry is starting to change. So we're seeing some industries where they are, Stephanie's talking about glyphosate. The more we demand organic food, the more organic growers we will have. And even if people can't afford everything organic, at least if they can purchase their oats and wheats and chickpeas and, these things that you mentioned, Stephanie, or, in the organic form, that's a start. And so I think it's coming. We're at the tipping point, and we just need to keep working hard.
Okay, so a common theme is everybody would like more education, and I'd like to propose we use the fish to teach the human beings how to be better people. I think that might be a start.
That's great.
Seems like the fish have a lot more compassion than some of the humans we all encounter. Another common theme here that you've all been talking about is this problem with government. And Brenda, you brought up the collusion with industry. And here in the United States, it's so appalling. I mean, I don't know if everybody realizes, but last year, the drug and device makers in the United States paid the FDA $2 billion in user fees. And for the last probably, I think, 7 years, the approval rate for drugs and devices is 96%. Now, would anybody like to see the 4% they turned down? I mean, it must be like intravenous arsenic, and there's probably a conversation in the hallway. Just submit it next year, we'll let it through. We have to act like we're paying attention. But this is appalling. And why don't we know about it? Guess who is the biggest advertiser on the major broadcast networks? Big Pharma. $51 billion last year in advertising just on 5 networks. So it's no wonder that only one message gets out there. How can food possibly compete with that? How can nutrition compete with that? And Big Pharma is not only controlling the media, but having a lot to do with controlling the social media, which Julieanna brought up as a major problem, people being deplatformed. So what I think has to happen is there have to be consequences. I'm a firm believer we've reached the place right now where bad actors have to pay the price for being a bad actor. We can just no longer sit back and watch this kind of misbehavior and say, oh, well, we're just stuck with it. We are not stuck with it at all. And I think that's the subject of our lawsuits right now, is to bring forth a great deal of information about this government pharma medical collusion, to get some of the truth out there. There's some data that would just blow your mind. And I'll give you one example and you can check it out as soon as we get off of this discussion tonight. Go to the Johns Hopkins, the dashboard that tells you about all the COVID rates all over. I'll give you some statistics, just a couple that'll blow your mind. I live in Ohio with 11.6 million people. And according to the data, we had over 18,000 deaths from COVID. In Vietnam, this was as of the end of February, 98 million people live there on top of each other, and they had 35 deaths. Does anybody think that's a statistic that's worth investigating? Not a single media person has looked into it. Nigeria, 209 million people, 1,700 deaths. The city of Shanghai has two times as many people as Ohio, 35 deaths, 18,500 here, all right? So there's absolutely no way to explain this, and somebody should be investigating it, right? So this is the kind of information that is not getting out there. So what we're going to do with these lawsuits is, first of all, prove the fraud. But the second thing, and this is very important, is we're going to go after the people who did it and take their assets away, because that's what they really care about. The guy our governor is worth $70 million. He has ruined 1 million people in this state. I think he should take that money, we should take it, and make those people whole. The governor of Illinois is worth $3.5 billion. If we took that money from him and we gave it to the people he ruined, we would make it very unattractive for people to engage in this behavior. We have got to make government accountable to people, not government taking advantage of people with the help of industry. And this is going on with animal agriculture. It's going on with technology. It's going on with food. It's going on with medicine. It's going on everywhere. It's pervasive. And I think once the dominoes start falling the other direction, we'll see all of this become unraveled, and we will actually start to put together a system where honesty is required and there are consequences for not being truthful with people. Everybody here has a story to tell that is being withheld from most people, and that's an intolerable state of affairs as far as I'm concerned. And it's been getting worse for the whole 26 years that I've been in this business. So that's what I think has to happen.
Okay, just one quick clarification. Dr. Seneff has said that whole food plant-based foods that we love, like chickpeas and lentils, when they're not organic, they're one of the most contaminated sources of Roundup and glyphosate. So I would just, in general, when people use the term whole food plant-based diet, we might want to stick the word organic in front of it, or no chemical whole food plant-based diet, so that when you go to a vegan restaurant, you have lentil soup and you're feeling great. What you really want is an organic version. And in no way do I want to deter. If it's easier just to say vegan to protect the animals, then that's great. But when you are saying whole food plant-based, maybe we could put the word organic in front of it. So I want to move to the next question, but before we do, I would like everyone to take just 1 minute only, just to tell everyone how they can get in touch with you. If they want to get your book, your website, if they want to speak to you, if they want to follow up, if they want to learn about you, what is the easiest way to stay in touch with each of you for just 1 minute?
I'll begin if that's okay, because I'm pressed for time. Actually, I really love listening to everybody, but I do have to peel away. But I will just quickly say, so I'm a practicing physician in Princeton, New Jersey. But as everyone knows, telemedicine, Zoom, you name the platform, you can reach anyone, anytime, anywhere. And so I've been doing quite a bit of that. So people can reach me through aileycohenmd.com is my practice. But what is really closest to my heart is my educational platform. So it is, I'll repeat it again, I said it earlier, The Smart Human. The Smart Human on Facebook, on Instagram, Twitter, Facebook. I have a podcast called The Smart Human Podcast, where I really, interview wonderful, really interesting researchers and biologists, toxicologists, environmental health lawyers. I just launched an environmental justice interview that I did with a wonderful person. So the podcast is The Smart Human, and I really hope people will check out the book. This is not for the money, I can assure you. I can really assure you that. But it's really because I put 9 years of work into this with my co-author, Dr. Frederick von Saal. And we're really proud of it. And it is absolutely empowering, proactive. It's what to do. It's soccer turf, what to think about. It's which alcohol, beer and wine, and how to look for cleaner versions. It's radiation. There's a whole chapter on EMF radiation, what the issues are and what to do about it. There's a whole chapter on home furnishings, medication. I want people to know that I myself am I'm a believer in medication, but I'm also a believer that there's a whole host of other tools we can use before reflexively giving medication, and there are risks. So, I am one of the people, I'm not sure who agrees with me, but I am vaccinated. I do believe in the vaccine. I think that it is saving lives worldwide and in the US. This is the way I do my business, is evidence-based, scientific, and I'm proud of that. And I challenge myself every day with what I read. So I just wanted to leave that information so people know who I am. So that may affect what they pick up and read and what they follow, because again, it's the messenger that a lot of us believe in. It's hard to tease out the details. So anyway, I hope people will support my work with high schools and social media and The Smart Human. And thank you again for having me and being a part of this wonderful group of ladies. Thank you.
Thanks, Ali. I just ordered your book.
Thank you. Please share, pass it around families. I say just
You
buy
bet.
one and pass it around. I'm happy about that.
You bet.
I'll go next. I'm Pam Popper. My email address is pampopper@msn.com. I do answer my emails, so feel free to email me. My company's website is wellnessforumhealth.com and Posner.com. I don't think that's me, but anyway, wellnessforumhealth.com. And my activism site is makeamericans.freeagain.com. I put out a newsletter every Monday. I put out 4 videos a week. That's all free. We have free workshops that are available on a regular basis. Like every week, there's a free workshop that somebody can participate in through my company. And you can be any place in the world and do it, because we do so much by Zoom and teleconference. Maybe that's one of the gifts of this whole thing, is we've all gotten used to using technology to reach more people in this way. And I think that's kind of a blessing from all of this. I have a new book out called COVID Operation: What Happened, Why It Happened, and What's Next. You can order that on Amazon or through contacting my company. So once again, pampopper@msn.com.
I guess I can go next. So my webpage is stephanieseneff.net. I have my new book, which I am very excited about. I hope that you will like it. Toxic Legacy: How the Weed Killer Glyphosate is Destroying Our Health and the Environment. I also have an MIT webpage, which is kind of complicated, but there's tons of stuff there with all my papers and my.
There's only one event on the planet where over 35 of the world's leading medical doctors.
Where it's csale.mit.edu, people.csale.mit.edu/Seneff is my MIT webpage, where I have many of my published articles posted, as well as many slide decks of various presentations and some podcasts, and a lot of information there. And then stephanieseneff.net, where I'm promoting my book. I have a blog there that's I'm trying to write blog posts on a regular basis, which is hard because I'm very busy. But yeah, I mean, you can search my name. Seneff is a rare name, so you'll see a lot of my interviews. I've done lots and lots of podcast interviews, and I've done a TEDx talk. So there's a lot of information about me on the web. It's being censored, I should say, to go with Pam. I really appreciate, Pam, the work that you're doing. I really appreciate it.
So I'm Theodora Scarato, Executive Director of Environmental Health Trust, and we have a website, ehtrust.org. We're a scientific think tank, so we have everything in terms of references, compendiums of research studies. That's at ehtrust.org. And we have information for policymakers, like who's taking action to halt 5G, where are some resources that can help you in raising awareness on this issue, how you can reduce exposure. We have a lot of downloadable fact sheets that we hope make it simple, or you can begin the journey of how to reduce exposure in your home. We have a newsletter monthly that we hope you will join us on. We try to get out the latest policy. You can find out what's happening with us and with our lawsuit. We are on Patreon, and we do more interactive in that we do interviews with experts and people who are working on this issue. And then you can ask questions and help us actually form that content. We also have a YouTube channel with lots of playlists related to children and technical science talks, people testifying about 5G cell towers, cell phones, and Dr. Deborah Davis, who's our founder and president, has some excellent books, Disconnect, The Secret History of the War on Cancer, which talks about industry influence into the science and policy of cell phone and wireless radiation. It is an incredible read. However, I'm going to have to say my favorite book is her book, The Secret History of the War on Cancer, which is just an amazing expose going back to World War I on different environmental issues, medicines, and how cancer, the war on cancer stopped being about prevention, and governments and scientists were fully aware of how we can prevent disease, but industry came in and so much has been covered up. So Secret History of the War on Cancer and ehtrust.org. Thank you.
You could find me at plantbaseddietitian.com. And I'm on all the social media, Instagram and Facebook as Plant-Based Dietitian, or Plant Dietitian, and Twitter and YouTube as my name, but they're all on my website, plantbaseddietitian.com. And I have a new podcast that launched on Valentine's Day called the Choose You Now podcast. So anywhere you listen to podcasts, you can find that. And my next book is the Choose You Now Diet, and it's due on Monday. So that's what I'm gotta go do as soon as we hang up. So thank you.
You can find us at Hippocrates Inst. It's HIPPOCRATESINST.org. We have our own magazine. It's free. It comes out 4 times a year. It's full of testimonials and the latest in science and what we have found. And a lot of people write articles for us that are amazing scientists and doctors and professors. We have a lot on our website, and for us, of course, it's all about education. This institute is we have like 20 lectures. We have tons of exercise, tons of energy medicine. We try to teach about everything that we can. And, I'm so happy to hear about all these new books, for sure. I got to get a lot of them. Thank you.
I'll go next. So I'm just going to make it easy. I'm just going to plug my new podcast, hopefortheanimalspodcast.org. I started a podcast, a pandemic podcast, because all my events went poop. So started a podcast. I just did a series of environmental themed ones for Earth Day. Next month, it's the podcast is sponsored by United Poultry Concerns, who I work for, and next month is International Respect for Chickens Month. So we're going to focus in on chickens next month. So Hope for the Animals podcast.org. You have to have a podcast in there because Hope for the Animals, that's what I wanted, but somebody else has it. So Hope for the Animals podcast.org. And all my information's there, email and everything if you want to get a hold of me. And I really encourage you to check out my new podcast.
Perfect. And I'm at brendadavisrd.com. I am on Facebook and Instagram, but I'm not very good at it. Julieanna is an expert. I'm just a baby at that stuff. But, and people can get a hold of me by emailing me at brendadavisrd at telus. Or no, just brendadavis@telus.net. So, yeah.
Okay. So you can also go to our website, therealtruthabout.health.com. And if you click on any of the speakers' names, it takes you to a page that provides their website information and how to get in touch with them. So that would be an easy way to follow up with any of our speakers with anything you want to speak about. Okay, so let me change the order of the questions. The next question is the punchline question and maybe the biggest purpose of this panel. What are the common causes or the common theme or the common solution that runs through all of these problems? So while someone might say, I'm very concerned about fluoridated water, what is the general thing that runs through all of the issues that are affecting our health, our climate, our forests, our soil, our food, the chemicals, the GMOs, the wireless technology, the diabetes crisis, the obesity crisis, the autism crisis, the allergies, asthma, attention deficit hyperactivity crisis, the pollinator crisis, and every one of the other ones I didn't mention, the fracking, the overfishing, the ocean acidification, it goes on and on and on. Are there general themes that you would say are common to all of you that are causing us to be in this situation that we weren't in 100 years ago? Is there something that you could look to and talk about that if we could solve, instead of solving one of these issues, we could solve lots of them all at once? I'd like for each of you to give a 2 or 3 minute answer on that.
Well, if you follow the money, the answer is clear. So I think money in not only does industry have big pockets and they can, buy commercials, buy scientists, fund science that has industry-friendly results, but they also fund our Congress people and our government. And you follow the money and the trails are just going everywhere. So in the world of EMFs and cell phone radiation, there was a Harvard report called Captured Agency by Norm Alster, investigating this issue in relationship to cell phones. And he talks about how the Federal Communications Commission is a captured agency. We have so many captured agencies in our government. We have also a public that is overwhelmed, and we're feeling trapped. I think people feel trapped and overwhelmed, and they need inspiration and hope so that they can take the steps that we need to take to fix these rather large and overwhelming problems, especially in relationship to technology. So I'm going to put a link in the chat to our page on how research is polluted by industry and policy and so forth. We have all the citations, and that's maintained the situation we have now, where the science and the facts are being downplayed and whitewashed by money.
Guess I can go next. I agree with you, and I think I would put my finger on the agrochemical industry and the pharmaceutical industry, which are really the same industry. So it's the chemical industry is a huge player in the mess that we're in today. And I think it's very interesting that the people who are poisoning us with the chemicals they're putting on our food are the same people that are making lots of money off of all of our medical problems. And so, what's not to like about that? If your interest is in money, you keep the population sick, and then you make tons of money. It's a very simple circular, solution that is wonderful for the pockets of these criminals who are really ruining our health. And the pharma spends more money as lobbying in the government than any other industry. And the medical system in this country, I believe, is a mess. It really has gone way in the wrong direction with this whole concept of patentable drugs as opposed to natural products. And then the wonderful people who are naturopaths and osteopaths and the functional medicine. I mean, all these wonderful homeopaths, all these people that are really offering alternative solutions that, you buy your medical insurance and it doesn't necessarily cover them. It's like forcing you in the direction of buying these toxic drugs and poisoning yourself even more when you're sick. And then on top of that, not only do they not encourage them, there's actual active suppression of their work. And the whole COVID-19 nightmare was just amazing with the degree to which ideas would come out from the naturopath community that were having wonderful solutions. I know doctors who have had tremendous success treating patients with just, supplements, vitamins, minerals, easy stuff that it should be obvious, and then getting really, knocked down because of it. Actually, even people are just struggling with surviving as a practitioner in a space where they should be heroes. They should be honored as heroes. So we're in a really frustrating situation right now with and of course, the food industry is controlled by all these processed foods, which are extremely unhealthy, even without all the chemicals that are on them. Just basically take the foods apart and then put the chemicals back together into pseudo foods. So we're just in a mess with respect to our health that is really, I think, a consequence of our food system. And then we have a pharmaceutical mafia that's controlling how we manage our health on the other side, and they're not letting the correct solutions take hold. They're doing everything they can to suppress them, and I just find that extremely frustrating. And the government, is being paid so much that they're happy to go along with the whole system, and meanwhile the citizens are falling apart. I just think it's criminal.
I echo what you say. Absolutely. And I mean, we're all talking essentially about the same thing. And if we don't disband this government private enterprise partnership, there's no hope. But, in my book, there's this chapter called The Perfect Storm. Like, how could this mess that we're in right now happen? And I think we had to have 4 things going on at the same time. And one of them is our education system is broken. We stopped teaching people how to think a long time ago. And the idea that in an Ivy League school, you need a safe space to go hang on to dolls because somebody says that something you don't like, this is appalling, people. This is what leads to this kind of groupthink that we're going to censor anything that we're going to control what everybody hears. This is actually being taught to students in college, all right? And they're trying to get it into the lower grades. We cannot survive as a population with unthinking followers. That's impossible. Because everything you guys are talking about requires critical thinking. And if we're raising people who can't think and are taught that thinking is bad, because if you say something somebody doesn't like, that's bad, we have no hope as humanity. I think the second thing is our government is out of control. And we're all talking about that. The third thing is the medical cabal. I mean, we didn't learn a lesson that we should have from the opiate epidemic, which is that the medical system had completely fallen apart. What happened was, let's just be honest about it. If we look at the opiate epidemic, about 10% of it was the pill mills, and the rest of it, 90%, was prescribed in private practices and institutions because doctors were told by drug reps that there was an epidemic of untreated pain and oxy was not addictive. And they believed it, okay? So you can't have a vibrant medical system where a significant percentage of the population of the people in charge of medicine can be persuaded by a drug rep to do something like what happened with the opiate epidemic, but we didn't learn anything, and so here we are again. And I think the last part of this has to do with the media, which is remarkably uncurious. I mean, that Johns Hopkins map is inexplicable, and you have never heard anybody talk about it. And wouldn't you think there should at least be a discussion about why 7 people died in Shanghai and 18,500 people died in Ohio, supposedly, okay? I don't believe that that's what happened at all, but nobody's asking about it. So So that's what has to happen. We have to take apart this partnership. We've got to make government accountable. And the only way that's going to happen, in my opinion, is to push it down to the local level. And I don't remember who said something about this, but it was a very important comment that you felt that that the traction was at the local level. And I think that's what's going to save us in this mess that we're in, is that we don't have really a top-down government. The 10th Amendment is alive and well, and a lot of decisions are made at the local level. And that's where we all live, and that's where we can have influence. And I think that we have lost sight of the fact that communities that we build at the local level can collectively have a lot of influence on what happens upstream. And so I've given up hope that we're ever going to get Congress to do anything right. I mean, they are a bunch of hopeless, witless people. I mean, they lie when the truth fits better, okay? So I think we focus on local and building communities of people who understand this and rise up from there. And I think that's the way that this will ultimately get solved, in addition to the courts.
I want to follow Pam. I love that. And you're right, people aren't being taught to think. And as a mother watching my children in school right now, it's horrifying to think what's going to be happening in the future. It's just getting so much worse. But not only are people not taught to think, we're also now very afraid to speak. And as a dietitian, I get shamed. I don't know if you, Brenda, have experienced this, for talking about things like weight loss, or talking about my book title is that my new book is a diet weight loss book, and it was supposed to be called Lose Weight for the Last Time, and it was too offensive. They wouldn't let me do that. So it's like, and doctors are afraid to tell their patients that they're overweight and that's harmful, and dietitians are they won't talk about any of this stuff because they don't want to offend anyone. So I think it's not only this ability to think, but there's this fear of offending people that's so pervasive right now that what do you even say? So when someone, wants to talk about diet and nutrition, you have to be tiptoe, and I just don't want to tiptoe. And so there's a lot of common themes here, and it's all about, the industry and who's controlling the narrative, and how do we take a stand, and how do we stand up for what we see and the information that we've aggregated and filtered, and we see our solutions and we want to tell everyone about it. And I see the themes, and I'm glad that we're all here talking about it. I'm so grateful for all of your work, and for everyone that's here thinking and talking and expressing themselves. And hopefully that's just going to get louder and stronger.
I'll go next. So it's interesting. So the question is, what's the common theme? And of course, my area is a little different from everyone else, but there is a common theme in that with what everyone's saying, because I think 30 years ago, I would have said, well, just go vegan. Just go vegan. That's, everybody needs to just go plant-based. And what we're learning in the 21st century activism is that supply and demand doesn't necessarily work the way we think it does. And there are subsidies and there are bailouts, and the government is so deeply involved in animal agriculture that what the market does, what people demand, doesn't necessarily reflect what's going to happen and how the government protects animal agriculture and the animal agriculture lobby. So I agree that there is absolutely a government component, a system-wide change that needs to happen, systematic change, not just on an individual level. That's very important too, and I don't want to diminish going vegan and being plant-based, because we do need to demand these products. That is very important, but there needs to also be a systematic change. And so something if anyone's interested in learning more about that or helping, I would encourage to look at the Agriculture Fairness Alliance, which is a new organization that is right now hiring lobbyists to go into Congress to fight for plant-based diet, plant-based subsidies, looking at the farm bill that's going to be coming up, and getting more energy around fruits, vegetables, grains, organic fruits, vegetables, and grains, rather than animal agriculture and regenerative animal agriculture, which there's a lot of energy around now. So there's definitely a common theme that we need systematic change on the government level to really make this happen. but still wanting to encourage that personal impact of going vegan, which is still so important because that's where it starts.
I don't have a lot to add, to be honest. I think everyone's covered it so beautifully. When Stephen asked the question, the thing I wrote down was follow the money. So that's the bottom line is, them that have the buck, so make the rules, and that's the reality. So I think we need to recognize that, and as consumers, we need to vote with our purchases, and we, I think, have so much more power to make a difference than what we give ourselves credit for. I'm always amazed at how powerful one young voice, a 10 or 11 or even 8 or 9-year-old child who decides to fundraise for whatever it is, can be more successful than some of the biggest organizations we have on the planet. And so I think we need to empower our children. We need to make our voices heard. We need to, continue lobbying. We need to continue working hard to make a difference. And we all know the arrow is pointing in a very one direction, and so we need to just do what we can to make our voices heard, and they can be very loud.
Thank you. So, what I see in my work that we do at Hippocrates is we tend to be herd animal. We tend to want to follow leaders. And I wish billions of people were listening to all what we were saying right now, because this is what people need to hear. And, if we, of course, our job is to educate one person at a time, and hopefully that is a ripple effect, and it's happening. We can't go back in time and say, wish we did this, but we can go forward. And I think thinking forward is that we absolutely need to do things on local level, absolutely, because that's where we live, that's where we have something to say. But, as we travel all over the world, and people come to the Institute from all over the world, and they bring their traditions, and of course we learn from that, but everybody, no matter what tradition they come from, can move over to a plant-based diet. And I think the common thing is, once we do, and we do it through our wallet, because no matter how big corporation, how big lobbyists are, if we do it with our wallet and we stop buying junk, we stop buying anything from the animal kingdom, then why would we have big farm houses where animals are totally raped, and it's unbelievable what's happening. If people really saw, and there's so many ways that you can see now. I mean, just seeing a movie like Dominion, you cry your heart out, and you think, oh, how is this possible? And you want to eat this? You actually want to put this into your body? The thing is, plant-based is frightening for a lot of people, because that means now I have to be conscious. I actually have to use my thinking, and I have to use my truthfulness about what really I know instinctively is right. And soil, our founder Andy Moore always says, it's the soil. It's all about the soil, because I can't grow anything if there's not good soil. So farming, I agree with Dr. Seneff. We need to go back to local farming, because there was really the big industrial farms that made it impossible for really good produce to happen, because then they needed to use pesticide fertilizers and all of that. We don't need that. I've always bought produce from small farms. I ran a clinic in Sweden. I always went to the Rudolf Steiner and bought all their organic produce, and everybody was amazed how it tasted and how rich it was and what it did to their immune system. So I hope people understand that this is the future. This is what you want to feed your kids, and do it with your wallet.
So assume that someone has listened to you and they're very motivated and they believe it and they're passionate and their heart is open and they're saying, this is my cause, this is my belief, I want to do something meaningful. Tomorrow, if everyone here and everyone who watches this on video in the future was willing to listen to do whatever you ask them to do, what's the very, very most effective thing they could do to create the greatest amount of impact to solve these issues? What do you want them to write a letter? Do you want them to march? Do you want them to run for Congress? Do you want them to tell their friends? Do you want them to start a conference, write a book? How is the greatest way we could support? What is the most impactful thing we could do if we 100% believe that this is urgent and we want to take the most direct action? How could we, what would be your wish list, or what would you ask us to do? What could we do to all the people that are hearing this message and want to take the most action possible? How can we help solve this issue, the issue that you're caring about? If each of you could comment on that.
I'll start this one. I would say be a joyful, loving, compassionate vegan. Bottom line, the best thing that you can do for the animals, for the planet. I think that's about as straightforward and easy an answer as we can give, but for my own personal perspective. So just live vegan.
I can go next. I think it's obvious to me that it needs to be grassroots, bottom up with respect to glyphosate. I think that's a very powerful weapon. And so anybody who becomes aware by listening to people like me who are informing them about the toxicity of glyphosate and the importance of eating certified organic, not just for the glyphosate, because there's lots of other chemicals in the food as well. Learn to eat organically and then buy organic. When you go to the grocery store, always look for the certified organic label. Tell your children, tell your parents, tell all your family, all your friends, you're doing this, and tell them why you're doing it, and ask them to, watch something that like Secret Ingredients, which is a great movie that shows how a family switched over to certified organic and everybody got well. Listen to Jeffrey Smith. I mean, I think people need to find out that there's a serious problem here with glyphosate, and then they need to act on it locally. And I think you can, as I mentioned before, you can have a lot of influence, I think, at the government level locally, but you will have, I really admire the people who are going to the federal government and trying to speak about this, because that is so difficult and such a struggle, and it's very hard. I mean, I think if you have the stomach for it, do that. But I think a lot can happen at the local level, and the local level still has power. And then, as cities start banning glyphosate, Mexico has banned glyphosate, and I think that's a huge signal to the United States. And in fact, the US is now worried that they're going to ban our imported food because it's contaminated with glyphosate. I hope they do. I mean, I think that if other governments start acting on glyphosate, eventually, I mean, the US government is deaf. I mean, they're really deaf on this topic. But I can't imagine they can't finally hear. And of course, there's all these lawsuits too. And right now there's a tremendous mess with respect to these non-Hodgkin's lymphoma lawsuits for glyphosate. That's been amazing. I was so stunned and so pleased when that first lawsuit, Dwayne Johnson using glyphosate in schoolyards, that was his job, his only chemical he was exposed to, young father of young children, 40 years old and dying of non-Hodgkin's lymphoma. I met him personally, and he's just a great guy. And he broke through the barrier that Monsanto was so proud that they always win the lawsuits. And now there's been just a tidal wave. There's like tens of thousands, I think, of lawsuits just on that one topic alone, non-Hodgkin's lymphoma and glyphosate. So I'm really hoping that, I mean, for example, if it can be shown with enough evidence that glyphosate causes autism, which I believe it does. And in my talk tomorrow, we'll talk quite a bit about autism and exactly how glyphosate could be causing it. If that one becomes, if someone wins a lawsuit on glyphosate and autism, that will also open up a floodgate. So I'm hoping that the lawsuits may be the downfall for that one chemical. And then of course the worry is they'll just substitute glufosinate or 2,4-D. I mean, there are plenty of other herbicides out there that are equally toxic. They need to get the bigger message that you've got to go certified organic in order to have healthy food, in order to have a healthy population, and also in order to have a healthy earth. Because I think glyphosate is a unrecognized, unappreciated contributor to global climate change. It actually blocks an enzyme in the plants that converts carbon dioxide into organic matter. And one of the ways that we can fight climate change is by just having the crops take the carbon out of the air, put it into the soil. And we're blocking that with glyphosate. And of course, we're getting all this runoff of nitrate and phosphate fertilizers because glyphosate is making the soil very erosive. We're losing the topsoil. You know, it's ruining the soil. Someone mentioned the soil is so important. Healthy gut, healthy soil. And we really need to start with the soil to get the soil healthy by nourishing it, by getting rid of the chemicals, using natural, as fertilizers. All of that needs to happen. We need a revolution in food. And there are many people who are working on that problem and learning how to grow organically, efficiently, and with cost effective. I think I hope we're going to have a real revolution in food, really going back to the methods we used to use with the small family farms. It's sort of a romantic notion on my part. I think that being a small family farmer is actually pretty cool. And so I'm hoping that, youngsters will start to think in terms of that as a possible pathway for their profession. So we definitely need a major overhaul of the food system. And of course, it also goes with the medical system as well. Natural for the food, natural for the medicines. It all goes together. And hopefully we're getting that message across, despite all the censorship.
So we need a revolution in technology as well. And the only way to do that is what has been talked about here, which is getting involved and speaking out, not being silent about this, educating your family members, taking a step forward. I know when I talk about technology, a lot of people who are, they've got clean water and they're cleaning up their food. And this is just like, no, not that, and we have to go here and address technology. So I would say be fearless and start speaking up to your elected officials. There are local groups working on wireless safety around the world. Certainly in the United States, in every state, there's a smart meter group or a 5G group. And getting involved is the way to fix this, I do believe, from the bottom up and then also from the top down. So addressing your elected officials and asking them to be accountable. Don't put the phone to your head. I mean, we have to protect the children. So I know that the CDC reported, that lymphoma is increasing. Cancer is increasing in our kids among all the other issues we've talked about related to ADHD and so forth. And I worked at an ADHD clinic for a long time, but when I first started out as a social worker, I remember my first child that I worked with ADHD. And I remember it was like, oh, what's that?
Mm-hmm.
And now the whole, there I was working at an ADHD clinic with all of these kids. It was like half the class or more in schools when I ended up working in a school. So now's the time. Thank you.
And I think, I think the one thing I would say is that we need to set an example. I think it's one of the most powerful tools any individual has, is to set an example of kindness and compassion and of living a plant-based or vegan life that is joyful, as Hope said, and to share food. Share food at your work, with your neighbors. I think for a lot of people, there's a fear of, losing the food that they love. And if they can be exposed to food that's absolutely delicious, then that, it makes it a little easier for them. So yeah, I won't go on too much.
I would echo that too, Brenda, and hope it's all about being a lighthouse. I like to say, be a lighthouse, not a tugboat. And if you're joyful and you get excited to talk about plants, like we get so excited to talk about it, and people are like, what is she on? I want some of that, you know? And you just need to have that energy because we're so excited about it and passionate and positive, as opposed to judging and you know, I just think that light is the best thing you could do, because after that, then everyone else wants to know, and then you can inspire, and definitely with the food, because you win people over with their palate for sure. And so, yep, just inspiring and positive, and be the best that you can.
It makes me think of a story from Florida, because Florida has this beautiful Everglades that brings in all the carbon dioxide, and it's like our water source. And what happened in the 1950s, we drained because we wanted to build up, and we kept draining it. And then finally, of course, we had started an airport in Miami, and then suddenly they wanted a new airport all the way in the Everglades. And one of the engineers that was a big part of that, he said, what on earth are we doing? And he went to the governor that had approved this, and he told him everything, what was happening and how we were going to lose. And we were not going to have water. This is our water source. And he said, how come nobody told me this before? Of course, so he stopped the project. So the Everglades still could exist. And of course, a lot have been drained. I mean, I'm in Florida here. A lot have been drained. That was a natural paradise, of course. So, but this happens because the people up in decision positions might not be educated at all about what they have around them. And if there is any way that we could remind them, of course we should. I still think that, yes, it's be an example, be the example you want, what you wanted to see, right? Tell your friends, but be the example. And that's, you know, we are all into that herd and herd immunity, herd followers, and people needs leaders that make sense. Just like that engineer, everybody said, oh, of course, you're right. And I think all of us are doing our job really in the same compassionate, passionate way. And whatever we can do, you know, maybe we should do more of this and try to educate people, especially women. I always talk to women a lot because we are the ones that can shape our community. I think even more than men, because we are the nurturers, we are the mothers. And if anybody should care about future, it should be us. And, you know, I know, of course, my husband and so many men here that work with us are totally compassionate and passionate about future, but we can shape it. That's our tool, and we got to take it.
I think my message to everybody is this issue of you have to be informed about issues, and you cannot any longer, we cannot live in a world anymore where we just put our head in the sand and hope that somebody's going to take care of things for us. And I'll just share a couple of things that I've learned from my experience. You know, we talk a lot about the American public. They don't want to do better for themselves. They just want to take a pill and this and that. And there's an element of people who I think that way. But what we found, when we were able to do on-site employer plans, one of the criteria that we would set, and I think this is really hopeful, what I'm going to tell you, is we wanted three 1-hour sessions with every employee to talk about what we do and health from our perspective, and then they could make their decision about whether or not they wanted to enroll in our program. And what was very interesting, we're talking about people being forced to listen to us for 3 hours against their will on company time. And when we would talk to people about there's no such thing as a chemical imbalance in the brain. So if you're being drugged for a psychological condition, that's ridiculous. Okay, here's why. That diabetes type 2 can be reversed in a matter of a few weeks if you eat the right diet. So we talk about all these different kinds of things. You know, the images don't really tell you much in an orthopedic office. we would have a 65% enrollment rate within a few weeks after those talks. And I think that speaks to the fact that if people are given good information, it's objective and it's presented in a way that's factual, they do act on it. So what we're suffering from is, how do we get this messaging, everything that we're all talking about, how do we get this in front of people so that they can make the right decision? Because it's astounding how many people will. And then I'll tell you about my mother, who was a very educated person, owned her own business, became a millionaire in her own right, and died probably 20 years younger than she should have, because she drank the medical Kool-Aid and got sucked into the medical mill. And she had surgeries that she shouldn't have had. And the last 10 years of her life, I wouldn't have wished on anybody. All right. But I will tell you this, if a person in a white coat had said to my mother, there will be no more surgeries, I won't do them, and I'm not prescribing any more drugs. You need to change your diet, stop smoking, get up, walk around. In a white coat, she would have listened. All right. Unfortunately, I don't wear a white coat. She didn't listen to me. It's hard to be a prophet in your own land, right? But I think that's an example of, we've got to change the system, because as long as most of the people in this country, that the information that they're getting is from traditionally trained doctors who are trained by drug companies and others. I'm not present company excluded. I mean, obviously anybody coming to this forum is going to be a different kind of health professional. But we have got to find a way to get this messaging out to the public so that they become more discerning consumers. Because how is it that a person with my mother's intellect and background could be sucked into this? It's because there was no opposing opinion then. And it's gotten worse, as we're seeing right now. So I guess the last thing that I would say, I love the things that you guys said about leading by example, because that's part of it. And I think part of our messaging has to be, and I've been talking about this for years, that every time we make a decision to do something, we're voting by being present for it, and we're voting with our checkbook. So I tell people to think about this, and I think, Hope, you'll like this. When you buy regular eggs at the store, you just go into the store and say, my family likes eggs, I'm going to buy eggs. What you're really saying is, I like water pollution, I like air pollution, I like having flies that are so dense around these barns and places where they have all these chickens that the kids can't go to school. That actually happened east of us here. They had to close schools down because of the flies and that sort of thing. I think it's great to eat food that's laced with antibiotics and steroids and hormones. And I feel so strongly about what a good idea this is, that I'm going to pay for it. I'm going to help finance it. Now that's a perspective. I don't think people think about that. They're just thinking, I like eggs, right? But these kinds of decisions get made every day in a mindless kind of way. And so I think as we're living our lives and trying to show people what the alternative to today is, I think we have to insert that by saying, look, it isn't just that I do what I do to be healthy. I do what I do because how I spend my money and how I spend my time says a lot about what I think is right to do. And I don't mean that in a you should do what I do sort of way. I mean it in a I thought about this consciously and made a decision. And you could think about it consciously and make a different decision, and I understand that. But the consciously thing is what we have to work on.
Okay, if each of you would take 3 minutes to make any final thoughts, any final comments, any final messages, any urgency, anything that you want to wrap up, that you want to leave us with, and future people on video that you want to make sure you're clear, anything you didn't get to say. Final wrap up, 3 minutes from each of you on anything further that you want to communicate to us and to our audience. Each of you could go.
Well, I'll go first. I mean, I think that as challenging as right now is, I think this is a fascinating time to be alive. I really do. Because sometimes things have to reach a critical point. We may have some differences of opinion about what that critical point is right now, but sometimes things have to reach a critical point in order for a large number of people to see enough what's going on for change to happen. And so I look at, I talked about education. I don't know if you're aware, but over 40% of children have been withdrawn from public school. out of the school, not schooling at home. I'm talking about we are not coming back. Now, whether or not that's a good idea from a number of different perspectives depends on a lot of things, but I'll tell you what, if the schools get empty enough, you know what's going to happen? Schools, education will change because it will have to get the kids back. And isn't that a nice thing where parents are being asked, Julieanna, you mentioned about your kids, what do we have to do at this school in order for you to bring your children back? That's never been asked before. It's here's education, take it or leave it. We're going to do what we want. Tell you something about medicine, and this is not a good thing, but maybe it is. 25% of all healthcare workers in the United States right now are unemployed because this whole COVID thing blew up the system. All right. And so that's a bad thing from a certain standpoint. But what happened is people got out of the habit for several months of hanging out with doctors with incessant testing and drugging and all the stuff that goes on that we know is not a good idea. Well, there are a lot of essays being written on Medscape and that sort of thing saying, what do we have to do to get the patients to come back? I don't know, maybe we have to do something different than happened before, right? Wouldn't that be great? And so, and I look at the media that's suppressing information in the whole 9 yards, the ratings are lower than they've ever been before. And what I think is one of the most hopeful things I ever heard, the Academy Awards went from 45 million viewers in 2014 to 8.5 million last Monday. Nobody cares. All these people are irrelevant right now. Isn't that great? So my whole point here is I think we live in a very interesting time where we're going to see some of the biggest shifts in our lives. And I'm excited to be part of it and on the positive end of it, rather than the people who are saying, oh my gosh, my world is falling apart. We can be the people who lead everybody out of this. And I think that's going to be fun to do.
I love that. I just chime in too. I think that's very powerful, Pam. And it's so true because there's so much difficulty right now. And there's so many challenges that we've never faced before. And people are seeing things and reprioritizing things and everything has changed. I think it stopped everyone in its tracks. And I agree that you could look at all the stressful, really scary things, or we could focus on all the positive things that are happening, the innovations that are taking place, the connections we're making, and hopefully some positive in the future. And I would encourage everyone to try to focus on that and do the best that we can in the situation and try to look for all that beautiful, empowering, positive stuff that's happening at the same time.
I guess I can go next. I really resonate with what Pam said, both of you actually, and I think it is very, very interesting times, and I feel very privileged to live in such interesting times. I feel that we're on the cusp of a major revolution in so many different dimensions, and there's tremendous unrest, there's tremendous polarization. Many people are very confused about what's the truth and what isn't the truth. You know, the things that are called false information are true, the things that are called true information are false. People are so confused. And I think out of the ashes is going to come an awareness that's going to really reach such a huge population that it can't be stopped, a revolution that can't be stopped. And again, grassroots, bottom up, people becoming aware and then becoming empowered to do something about it. Because I think to just get depressed and say the world is hopeless and I just have to go crawl in a hole and die, it's not the right answer. We have the power, we have the capability. If we have the will, we can do it. And we almost even know what to do. I mean, many of us are really realizing what it is we need to do. And to just say, we can do it and take it on and be excited about the future that's coming, despite all the negativity that's happening right now with the tremendous government control and the censorship, and then all the disinformation that's coming from the mainstream, which is so frustrating with them sort of claiming that it's coming from the other side. It's just, people are really, really confused. But I hope that enough people are waking up and realizing and being called to action, and that we will have the strength to do what we need to do to really change this into a very beautiful world with a healthy population, and everybody can thrive.
I'll go next. I'll just echo what everyone has said. All these amazing women that we're kind of at a crossroads. this thing could go either way, really. We could go down a very dark, scary path, and we could also create a beautiful, amazing world. And I think that, like what has been said, that's going to be determined pretty quickly, possibly within our lifetime or our children's lifetime. And so really, it's about our survival on this planet. And I know some people, especially in the animal community, will say, well, the humans deserve it. Just, let them kill themselves off. But we're taking the rest of the planet with us. We're taking all of life, the beautiful, diverse, incredible life on this planet, the animals and plant life with us. No, let's not do that. Let's find a way to survive and thrive, humans, animals, the planet, in harmony together. And I think we all have wonderful ideas about that. One thing that I will just reiterate once again, because it is my life's purpose, is to speak for these animals and just remind everyone to think about them, think about the animals that are on this planet, not only the farmed animals, but every animal on this planet, that the other than human animals that are so affected by everything we do, everything we buy, everything that is going on. So just making choices. I've always thought that just vegan is not really enough. We need a fundamental spiritual, if you want to call it, shift in our consciousness and our psyche to a more compassionate, loving, connected world, and just doing whatever you can find in your heart to do that helps us to bring about that incredible world that we all want to see. So let's steer this ship and take it to the place of a loving, beautiful future, and try to avoid calamity by all working together and doing all that we can do to be compassionate, loving, wonderful vegans. So thank you.
I'll continue along that same vein, Hope. I think what is needed is, I think we need to recognize that our choices matter. Our choices matter for our own health and for the health of our families and all of the people that we associate with. They matter for the animals. They matter for the future of this planet. They matter for people. I work with the Marshallese people and have for many years, who have the highest rates of diabetes on the planet. They were used as atomic bomb testing grounds. They but they will probably be the first to go because of global warming. Their islands will be wiped out. It's this, they have this kind of triple threat, if you will. And our choices matter to the Marshallese people. They, when we choose, to eat the way that we're eating, it means a quicker demise for that population. Our choices matter so much, and we need to become more conscious human beings, just recognizing the consequences of every time we spend $1, what that really means. And we need to teach our children to do the same. I think what we've seen and what we learned through COVID is big pharma and governments I was thinking that something should go this way. And I think what people realize is that this is more or less showing survival of the fittest. But then we realized now there's so many of us that are not fit. There's so many of us that have diseases, and we're, whatever we think COVID came from, but obviously it's a synthetic pathogen and our bodies did not make it. So what happened is that now we became much more compassionate about people that we could help, and we could help them
to have fitness. And, you know, here at the Institute, that's what we are about, like get you to be fit. They said, even if I lose 5% of my weight, 5%, I have 60% greater chance to even survive this synthetic pathogen. So I think what we're seeing is it kind of flipped back in not the way that the governments and big pharma had planned it, because that's what I believe happened. And you can believe what you think, but if one day you'll see, one day the truth will come out. And we need to be compassionate about every person on this earth. And when people say, you know, we're too many people, no, we have plenty of room on this earth if we go plant-based. It's plant-based that's going to do it. That's going to, organic, of course, is the biggest thing, because as long as I spray, I say to our guests here when they come with a beautiful plate full of sprouts and vegetables, hey, no, before you eat it, I want to spray some Roundup on it. And they're like, no, wait. Well, that's exactly what you get if you don't go organic. So I think that we need to be compassionate. We need to help our sisters and brothers to get to fitness any which way we can. First of all, be the example.
There is a worldwide movement towards safe technology, and I hope that people are inspired to take some actions on this issue. In the United States, there are city councils like Hawaii County, Fergus, Tennessee, and on our website we have the list every time someone gives us a city that has passed the Stop 5G resolution or a resolution to address some of the accountability issues related to technology, like there needs to be an environmental review by the FCC on this issue, or our locality needs to do adequate environmental review before we roll out all of these cell towers and devices. And in other countries, in Italy, there are 600 cities and municipalities that have passed 5G resolutions. There was recently actually a hunger strike going on there. I think it's still going on, although they're rotating now, because the country is looking at changing their more protective than the United States limits related to cell tower radiation. And people are becoming more aware of the issue of wireless. There are many, like France, Israel, Cyprus, have banned Wi-Fi in different settings, different school settings. And so things are happening when we speak up. And I hope that people will speak up and start talking about this and just be thankful. And I'm just so thankful to be on this panel with all of you. So thank you.
Please unmute everyone so we could thank the panelists.
Thank you. Thank you.
Thank you all.
Thank you so much for all you ladies.
Such a
Such amazing
Thanks, Stephanie.
discussion. Thank you
Guys.
so much.